Okay, let's get right into it. When it comes to spine care, regenerative medicine is probably one of the most confusing areas out there today. I mean, you see ads that promise the world, and then you hear some doctors just dismiss the whole thing. So what is the real story? Well, that's exactly what we're going to break down.
So on one hand, you've got this aggressive marketing, making these huge promises. And on the other hand, you've got these blanket dismissals calling it all unproven junk science. The truth, the answer that's actually useful if you're the one in pain, is sitting right in the middle of those two extremes. And that's where we're going.
All right, so to cut through all of that noise, we have to start with the basics. We need to understand what we are even talking about. So let's begin with the first major player in this whole conversation, platelet-rich plasma, or as you've probably heard it, PRP.
Now, the idea here is really powerful. This isn't some new drug from a lab or a foreign substance. We are literally talking about taking your body's own biology, your own built-in healing system, concentrating it, and then delivering it with absolute precision right to the source of your pain. It's your healing potential, just amplified.
And you might be surprised at how straightforward the process actually is. It all starts with a simple blood draw, just like any other. That blood gets put into a machine called a centrifuge that spins it really fast to separate everything out. We collect that valuable, platelet-rich layer, and then, and this is key, we use imaging guidance to inject it exactly where it needs to go, right into the damaged tissue.
So what's the big deal with platelets? Well, you can think of them like these tiny little biological treasure chests. They're just packed with these things called growth factors. And growth factors are the signals that tell your body, hey, build new blood vessels here, make more collagen, repair this tissue. You're essentially sending a powerful, concentrated biological message right to the injury site that says, heal here.
Okay, so that's the what. The theory is great, but that's only half a story, right? Now let's get to the most important part of this entire conversation. What does the actual long-term hard science say?
So let's really zero in on the area where the evidence is the strongest. We're talking about chronic low back pain that doctors have confirmed is coming from the disc itself. We call this discogenic pain. For these patients specifically, what does the research really tell us over the long haul?
71%. I'm just going to let that number sit there for a second. Because that's not a marketing number, it's not a guess.
And here's the crucial context. That 71% comes from landmark scientific research. It's a finding that's actually backed up by clinical guidelines from major medical organizations like the American Society of Pain and Neuroscience. For the right patient, a single injection into that damaged disc can lead to real, durable relief that lasts for years. That is a real number.
Now, if we're going to be totally honest, and that's the whole point here, we have to talk about the other big name in this space, the one that gets so much attention and, frankly, creates a lot of confusion: stem cells.
And this slide, this really says it all right now. When it comes to spine pain, the solid published evidence is here today for PRP. Now, don't get me wrong, the research on stem cells is incredibly promising, especially for disc pain. But for most spinal issues, the marketing has just gotten way, way ahead of the science. The proof simply isn't there yet.
This quote from Dr. Kamal Woods at Vertrae in Dayton, Ohio, it just nails the whole philosophy of an evidence-first approach. It's not about what's trendy or what's being hyped up. It's about offering what the science has earned the right to be offered. And for spine pain today, that's primarily PRP. When the evidence for stem cells gets there, the options will expand, but not a moment before.
Okay, this part is so important. PRP is not some magic bullet for every single person with back pain. The amazing success we just talked about, that's 71%, it all depends on applying this powerful biological tool to the right patient with the right problem at the right time.
So who is that strong candidate? Well, it's a very specific clinical picture. We're talking about someone with chronic low back pain that we know for sure is coming from the disc. Their disc degeneration is in that early to moderate stage, not completely worn out. They've already tried things like physical therapy and medications, and it hasn't worked. And critically, they don't have some big structural issue that clearly points to needing surgery.
And you know what? It's just as important to be upfront about who this is not for. If the main problem is pain shooting down the leg, or if that disc is just severely degenerated, or if surgery is obviously the right answer, then PRP is not the right conversation to be having. Being honest about that is absolutely key to getting good results.
It's also vital to set realistic expectations about the timeline. This is not a quick fix like a steroid shot that masks the pain right away. Remember, this is a biological repair process. The data shows us that meaningful relief usually starts to kick in around the 2-month mark, and the peak results are typically seen by 6 months. It's a process of healing, and that takes time.
Okay, so we've covered the what, the why, and the who. So now the big question is, how does all of this actually apply to you as an individual person who's dealing with chronic back pain?
And here's the bottom line. An explainer like this, it can give you the evidence, it can give you the facts, but the real answer for you can only come from a personal, one-on-one evaluation. It takes a deep dive into your specific situation, your imaging, and your history to see if your story matches up with the research we've been talking about.
So the final question is pretty simple. If you have chronic back pain and you're wondering, could my own biology be part of the solution? Where do you get a straight answer? Well, that conversation starts with an expert who puts the evidence first. It's all about getting a clear, honest picture of what the science supports for you. No hype, no dismissals. Just an evidence-based conversation with no surprises.